Okay. All right. Are we on chapter 6? Okay. So, applies fundamental knowledge of the emergency medical services system, safe well-being of emergency medical technicians, medical, legal, and ethical issues, provision of EMS. So it's kind of like what I said, safety well-being of the EMS. So chapter 6 is the human body. It applies fundamental knowledge of the anatomy and function of all human systems to the practice of EMS. Why is this fundamental? Or fundamental for EMS? It sounds like a stupid question. It's a stupid question, but a lot of people don't actually think about it. EMS is all about mental, physical, and emotional side effects. Cover all three. Pathophysiology applies fundamental knowledge of the patho and respiration and perfusion to patient assessment and management. Does anybody know what perfusion means? Perfusion is the circulation of blood. Getting the blood from the heart. All right. Working knowledge of because, like I said, for right arm return, knowing which part and what connects to what helps, don't it? The shoulder doesn't connect to the hip, so her hip hurt, shoulder hurt are two different things. Topographic anatomy applies to the body and the anatomic position. I know what the anatomic position is, like how the body is set up for it. The body's laying supine, which is on your back, so laying completely flat, or you can stand up. And you arms forward, stand straight up, arms out, feet together, palms forward. The anatomical position of the body. That's how you look at things. That's how you're able to split the body and knowing what's wrong and what's not. Planes of the body. All right. So imagine straight lines that divide the body, and you have frontal or coronal. That divides the body front to back. So if I split, say this not my bottle, look at that. I split the body straight like this, straight down the lip, straight down. I have a front and a back half, right? You have the lateral or the sagittal planes that divide the body left to right. So if I split my body up and down, which means left and right. I have the right side of the body, I have the left side of the body, which helps with the organ flow. You have organs on the right side of the body and the left side of the body that aren't always like, do not cross. Here's the midline, which divides the body into equal left and right halves. Kind of the same thing as the second one, except the midline is where you base everything. So your EKG placements, yeah, V1, V2 on each side of the midline. And then you have your transverse axle. So straight up, so top and bottom. So you split straight up, top and bottom. So you got your transverse, which splits it. And the transverse split. And you have your frontal and corner planes, which is cells and systems. From your most simple to your most complex. Cells are the foundation of the human body. Cells wouldn't have body. Tissues are the cells that share a common function. So your stomach cells don't share the same function as your heart cells. Make sense? So your tissues are a group of cells that form a same function. Organs are a group of tissues that perform similar or interrelated jobs. Body systems are organs with similar function working together. All right. Skeletal system. We know how many bones we have in the human body without looking at them. You have split into three different skeletons. So your exoskeleton, your appendicular, and your pelvis. Exoskeleton is the skull, facial bones, the thoracic cage, and your vertebral column. A lot of words I'm going to struggle with today. So, how does your skull and each other? Like the face. Yeah. The simple word for it. Okay, right? The reason it's called thoracic is it covers your thoracic region. Covers your heart, lungs, diaphragm, stuff like that. Yeah. Thoracic cage is also known as the rib cage. And I tell me what the vertebral column is. Big word. Yep. That's why it's called a column. It's just trying to make things as from the very complicated to the simple as you can make it. Alright, so your joints occur whenever bones come in contact. They consist of the ends of the bones that are connecting and supporting tissues. You have two types of joints. Which two? Someone can read the word. Okay. Yes. Okay, so your ball and socket allows rotation and bending. Which type of body part is your ball and socket? Shoulder. Yep. Hinge joint. Motion restricted to flexion and extension. A lot more simple than people think. Yep. Shoulder is an example, and elbows are hinge joints. All right, the axial skeleton, which is made up of your skull and your facial bones. Your cranium is made up of four bones: parietal, frontal, temporal, and your occipital. Yep, I look at it. Again, face is made up of 14. Not reading on 14.
Does registry touch on all that
I have, I have had a question about one of the skull parts. Because the patient had a cut and it said what part of the skull was cut on.
I think I have one of the planes.
I have one about it. I had a scenario question asking, you have a 2 centimeter lack on the head, gives you a picture what part of the head is on. Your spinal column is composed of 33 bones divided into 5 sections. Your cervical, which is your neck. Thoracic.
Sorry.
No, you're good. You're good. Yeah, so divided into 5 sections, you get your cervical, which is the back of your neck. You have your thoracic, which is also the back side of the rib cage. You have your lumbar, which is your lower back, which every single person that's in the back hurts exactly where the point is. And then you have your sacral vertebrae. Then you have your coccyx. Well, if you break the butt, break the coccyx. And the kind of the ones that you can't really do much about, but they give you a donut to sit on. Really much they can do about it. Your thorax. Formed by 12 thoracic vertebrae and 12 pairs of ribs. Knowing your rib location is not meant for, I don't think is needed for a test. She's not going to test you on it, but knowing your rib locations for your clinicals would be a good idea. For your EKG placements. For, you start to do your blood pressures and stuff. You want the body in your anatomical position to take the blood pressure. That's where the planks and stuff come into play. Your xiphoid process, which is the bottom of your sternum. When you do CPR, you do not do it on the xiphoid process. Do it in the middle of the sternum. Right? The thoracic cavity contains your heart, lungs, esophagus, and your great vessels. Let me know what your great vessels are. Like one or two. You're thinking. I know they are. Your superior, inferior vena cavus. Great vessels that bring blood to and from the heart to the body to the lungs. Your appendicular skeleton. Arms, legs, and their connections, points in the pelvis. Includes your joints, upper extremities, your pelvis, and your lower extremities. I think it's something to say. Upper extremities. Upper extremity extends from the pectoral girdle to the fingertips. I know what the pectoral girdle is. So it's all starts all through. Composed of the arms, forearms, hands, and fingers. All right. Shoulder girdle. 3 bones come together. Clavicle, scapula, and humerus. Clavicle. Very, very easy bone to break. A very, very common bone to break. Your scapula. Shoulder blade. And your humerus. Humerus?
Maybe I broke the bottom half of the humerus.
Ouch. Arm. As part of your upper extremities. Humerus is the supporting bone. Forearm consists of the radius and ulna. Radius is on the lateral side, and ulna on the medial side. You know which one is which? One of your thumb. So good way to remember it. Radius goes to your thumb. Ulna goes to your pinky. All right. Wrist and hand. Wrist is also a ball and socket joint, so you can make a full socket. Principal bones: carpals, metacarpals, and phalanges. Favorite word. Have you got any questions so far? the pelvis. Pelvic girdle consists of pelvic, hip bones, the sacrum, and coccyx. Female's pelvis are usually wider. The hips are wider due to being able to have children. Males are usually a lot more narrow. Each pelvic bone is formed by the fusion of the ilium, the ischium, and the pubis. Pelvis. The ilium, ischium, and pubis bones are joined by the sacrum. This is your hip, and the bone socket will go right there. And then your pelvis comes together. And like I said, males are usually more narrow, females are usually more wide. Then the pubic symphysis is where the right and left pubis are joined. So it's where the pelvis comes together. The lower extremities, your femur, the longest bone in the body, is also a very hard bone to break. Not impossible, it does happen. Connects to the pelvic girdle where the ball and socket join. The greater and lesser major muscles of the thigh connect to the femur. So femurs are very hard to break. Very hard bone to break. The amount of muscle that surrounds it. And also of the density of that bone. Knee connects with the upper leg to the lower leg. Your kneecap, patella, usually the one that's the only bone right my sister knows. She goes screaming around the house saying, I'm touching my patella. Okay. Lower leg is your tibia, your shin bone, and your fibula. That's the two bones that help keep it upright. Alright, your lower extremity is your ankle, another hinge joint. Allows connection and extension of the foot. Ankle is not meant to go in a big circle. Alright. Your foot contains 7 tarsal bones, 5 metatarsal bones that form the substance of the foot, and toes are formed by phalanges. Phalanges on top, phalanges on top. Your Achilles tendon. With your sport injuries, that is something to look for. If they start screaming about their foot or their back of their leg hurts. A good way to see if the Achilles tendon is still intact is squeeze the calf. If the foot flexes with it, the Achilles tendon is still attached. If it doesn't, that is what's smacked. The Achilles tendon has been torn. Your skeletal system. Its shape protects the fragile organs, allows for movement, stores calcium, and helps create blood cells. Anybody have any questions about the skeletal system before we move on? Okay. The musculoskeletal system provides form, upright posture, movement, protection of the vital internal organs. Types of muscles. You have 3 different types. You have your skeletal, which is your voluntary, so I tell my arm to move. Your smooth muscle, your intestinal line, your GI tract. Then your cardiac muscle. It might explain why your cardiac muscle is the muscle. Cardiac muscle is the heart muscle. So your entire body is covered in muscles. That's how your body moves around. From Contraction and relaxation of the system makes it possible to move and manipulate the environment. A byproduct of the movement is heat. Another function of the muscles is to protect the structures under them. So you're going for a run. You go for a run. Moving those muscles create heat, create sweat. There's a lot more to it than that. That's the simple one. All right, airway. Structure of the body that contribute to respiration. Respiration is a process of breathing. You have your upper and lower. The upper airway contains the nose, mouth, tongue, jaw, the larynx. Like I said, it divides into your upper and lower airways from there. Your mouth is your oral cavity, and your jaw is your mandible. The larynx is also known as, knows the larynx is also called? The pharynx contains your nasopharynx, your oropharynx, and your pharyngopharynx. I always mess up. Your trachea and your epiglottis. And you know what your epiglottis is? It's a flap on the top of your trachea versus your esophagus. So when you breathe, your esophagus is closed. When you eat, it covers your trachea while the food goes down. So you don't inhale. Your food doesn't go to your lungs, it actually goes to your stomach. Your thyroid cartilage, Adam's apple. Every male has one. Some you can see more than others. Cricoid cartilage, immediately below the thyroid cartilage in your trachea. Ends at your carina, dividing into the right and left bronchiole, leading to the bronchioles. So the carina is at the end of the trachea, right where it splits. So your trachea is one tube that splits into two. When it splits into two, that's your lungs. It splits into a lot more. The two lungs are held in place by the trachea, arteries and veins, pulmonary ligaments, and it's divided into two lobes. Right lung has an upper, middle, and a lower lobe. The left lung has an upper and lower lobe. Can anyone tell me any kind of reason of why the left lung doesn't have a middle lobe? Something else sits there. Your heart sits on the left side. So your right lung has 3 lobes, left lung has 2 because there's something in the way. In the lobes are bronchioles, and alveoli, unless your gas exchange. The pleura is a layer of smooth, glistening tissue that covers each lung and lines the chest cavity. So it protects your lungs. It allows your lungs to expand and get out. Between the two layers is a small amount of fluid that allows the tissues to glide smoothly. There's a lot of fluid in your body. It's not just blood or your spinal fluid. It helps things float around. Everything in your body is attached to something that's usually free floating. Your thyroid cartilage, your cricoid, and your cricoid cartilage are all part of this. Your trachea is also known as your windpipe. Someone might say, like, they got a hidden throat, they can't talk, they can't breathe. Probably because their trachea has some bruising or got damaged in some way. Alveoli, your main bronchi. So your main bronchi, here's trachea, then it splits. So it splits into the right and left lung, and then in each lung, it branches out. And it gets smaller and smaller and smaller until it's microscopic. Then it gets to the alveoli. That is where your gas exchange happens. The oxygen does not just go to the lungs and go into a cloud of smoke and There you go. That's where your oxygen goes in, carbon monoxide comes out. That's how you breathe it out. Right? And the alveoli is where the gas exchange happens. Your carbon dioxide goes into the bloodstream and goes up, and you're able to breathe it out. Muscles of breathing. The diaphragm is the primary muscle of breathing. What helps your lungs. Also involved are your neck, which is your cervical muscles, your intercostal muscles, which is your muscles in between the ribs, your abdominal muscles, and your pectoral muscles. A lot of things go into breathing. Your diaphragm, your intercostal muscles contract. Pressure in the thoracic cavity decreases, and your lungs fill with air. So pressure goes down, air goes up. Testing material. Inhalation is an active part of the respiratory cycle. It takes as an active part. Diaphragm and intercostal muscles relax. The thoracic cavity returns to its normal shape and volume, but then the thoracic cavity's pressure goes up, goes back to normal, and the air in the lungs go down. Exhalation is a passive portion of the respiratory cycle. It doesn't take energy to exhale. It takes energy to inhale. I'm going to get back for a minute. Respiratory system physiology. The function is to provide body with oxygen and eliminate carbon dioxide. Ventilation and respiration are separate. They're interdependent functions of the respiratory system. All right. Another possible test. Respiration is the exchange of oxygen and carbon dioxide in the alveolar tissue. Respiration is the exchange of oxygen and carbon dioxide in the alveoli tissues. It provides oxygen to the cells and removes waste. Diffusion, passive process in which molecules move from an area of high concentration to an area of low concentration. As if they want to be everything wants to be balanced. So if there's too much on one side, they're going to migrate to where everything's balanced as much as it can. Brainstem controls breathing by monitoring carbon dioxide in blood and spinal fluid. The primary reason for breathing is to lower the carbon dioxide levels. Everyone thinks the drive to breathe is just to keep you alive, because we need it. Yes, we need oxygen. That is not the primary reason we breathe. We breathe to get rid of carbon dioxide, to get rid of the waste. It's called a hypoxic drive. And we know what hypoxia is. I went into it before. Oh, yeah, that's the Google definition. Or not the book definition, but the hypoxia, the blue lips, blue in the fingernails, the cyanosis and the blips in the fingernails. There's too much carbon dioxide and not enough oxygen. Hypo means low. So hyper. So hypo, you're hypoxic because you're low on oxygen. Your nervous system controls your breathing. You get an injury to the back of the neck. You get some sort of cervical accident. You have a really bad football car accident. Usually put people that are in car accidents, usually if they have some sort of complaint that complaint to get in that depending on how bad they say. The medulla initiates the ventilation cycles, stimulated by a high carbon dioxide level. Again, not your oxygen levels. You have too much carbon dioxide, the body tells it, hey, we gotta breathe. The pons has two areas that help automate respiration during emotional or physical stress. So people who hyperventilate. Too much ventilation. Panic attacks. It causes tingling in the fingers, tingling in the feet, tingling in the face. Why is it tingling in the fingers and feet, not like the body? Like not in the torso. Action to protect the torso, to protect the vital organs. The body can live without an arm. Can't live without that. So what do you do to help somebody with a panic attack? Talk them down. Yep. Try to get their breathing back under control.
Yeah, like
Mm-hmm. Yeah, that's what I say to you. What? I mean, you can, but that makes them focus a little bit more. But that can also. But I say to smell the roses, blood candles. Totally gonna smell a candle. Smell the candles. Alright. Ventilation is simple air movement in and out of the lungs. Requires chest rise and fall. So when we check to see if somebody is breathing, what do we look for? Tidal volume is amount of air moved into or out of the lungs during a single breath. Residual volume is the gas that remains in the lungs to keep the lungs open. So when you breathe out, your lungs don't like shrivel up into like little they are still open. Your dead space is the portion of the respiratory system that has no alveoli and where little to no exchange of gas between air and blood occurs. So think of dead space. All right. Your respiratory rate times your tidal volume equals your minute volume. What is the normal respiratory rate for an adult? 18 to 20? 12 to 20. You're fine. You're still within the normal range. It's normally, you write down the respiratory rate, it's normally around 17. Now, if somebody's breathing 22 times a minute and they're not in any kind of distress, are we going to worry about it? No. Now, if someone's breathing 6 times a minute, you might watch them a little bit. Characteristics of a normal breathing. Your normal rate and depth, which is your tidal volume. Regular rhythm or pattern of inhalation and exhalation. Is inhalation active or passive? Yep. Basically, yeah. What do you think about it? Your clear and audible breath sounds on both sides of the chest. You will hear. It may be a little more quiet, but you will hear it. If you hear normal, that's normal breath sound going back and forth. Regular rise and fall. Movement on both sides of the chest. Why do you want movement on both sides of the chest at the same time instead of just one rising and one staying down? You need both lungs. Good oxygen. One lung can help for so long. You have two lungs for a reason. And movement of the abdomen. Inadequate breathing patterns in adult. You have your labored breathing, your muscle retractions, your pale, cyanotic, cool, your background clammy skin. Makes them. You have your tripod position. And what your tripod position is. But you're just like this because they can't breathe. They're focused all of their energy forward. It's a lot of times they're headed down and they're focusing on their breathing. Your agonal gas. I'm pretty sure every single one of you here has some sort of cardiac arrest or has been around it. Has anybody not had a cardiac arrest or an overdose? Okay. So your overdose, the heart's still beating. Like you get one breath every 5 6 seconds. That's your agonal breathing. That's the body's last stitch effort to get some sort of breath. Alright. Any questions of respiratory system? Circulatory system. Your complex arrangement of connected tubes. So, circulatory system, you have your pump, your heart, your tubing, your arteries and veins. You got your arteries, your capillaries, your venules, and your veins. No, arterioles. You got two circuits. You have your systematic circulation and your pulmonary circulation. Pulmonary covers the lungs. And your systematic covers the body. Alright. Anybody else intimidated when they first saw this? Because I was when I first got into EMT school. It is not as complicated as you think. So your heart has 4 chambers. You know what the chambers are? You got your 2 atriums and your 2 ventricles. You got a right atrium, right ventricle, left atrium, left ventricle. It is a hollow muscular organ made up of specialized cardiac muscle works as 2 paired pumps. You got your atrium, which is your upper chambers, your ventricle, which is your lower chambers. No, this is not Harry Potter. Circulation. The heart receives its blood from the aorta. The right side receives deoxygenated blood from the veins. The left side receives oxygenated blood from the lungs. Your normal resting heart rate is anywhere from 60 to 100 beats a minute. Your stroke volume is your amount of blood moved by 1 beat. Your cardiac output is the amount of blood moved in 1 minute. Your get your cardiac output, you get your heart rate, you multiply it by your stroke volume, and you get your cardiac output. The heart has an electrical conduction system. Your specialized tissue capable of initiating and conducting electrical current causes smooth coordinated contractions, and your contractions make your pumping action. Arteries carry blood from the heart to all of the body's tissues. Your aorta branches into the coronary arteries, the carotid arteries, your hepatic arteries, the renal arteries, and mesenteric arteries. Pulmonary arteries carry oxygen poor blood to the lungs. Arteries branch into small arteries and then into the arterioles. The arterioles branch into a series of increasingly smaller vessels until they connect to the capillaries. This might be where something like your vocab comes into play, knowing what everything means. Your pulse is palpated most easily at the neck, wrist, and groin, created by a forceful pumping of the blood out of the left ventricle and into the major arteries. How do you check a pulse and the wrist? You check with your thumb? Why do you check with why don't you check with your thumb? Yep, you get your own pulse in your thumb. So you check your own pulse instead of your patient's pulse. I don't know if you check pulse more. You can do 30 seconds for a minute, 30 seconds for a flip, you get your minute. So you have your veins and arteries go all the way from your head to your toes. If you say you put on a tourniquet right here, what does that do? Here all the way down, right? So to cut blood flow off to the rest of the foot or rest of the leg, right? Okay, if you put it right here, okay? Do you put a tourniquet around the belly, around the neck, no matter how much maybe you want to? I can only imagine. Take it off now. Right. It happens. People, because I think bleeding, tourniquet. I was taught where to put tourniquet. Because people just go to buy it and no one knows. I mean, the thing is, I was gonna think too. People who aren't in the medical field, extremity comes off the torso. A lot of people don't. Thing is, when you're in that kind of like, oh no, what am I gonna do? Thinking goes up. All right, your capillaries connect to the arterioles and the. I'm gonna say this wrong the entire thing, but the venules. That's how I say them. Fine and divisions of the arterial system allow contact between blood and cells. That's how your oxygenation gets all the way around. Your veins return oxygen depleted blood to the heart. The superior vena cava carries the blood returning from the head, neck, shoulders, and upper extremities. So you have a superior and an inferior vena cava. The inferior vena cava carries blood from the abdomen, pelvis, and lower extremities. And they both join into the right atrium. So blood from the entire body pulls the spleen. Solid organ located under the rib cage, filters blood, particularly susceptible to injury from blood trauma. This is one of the first things we think of when someone has gotten hit with a blunt object in the abdomen before we can realize where it's at. Your blood composition may or may not be tested. This is definitely on registry. Your plasma, your red blood cells, those are your erythrocytes, your white blood cells, those are your leukocytes, and your platelets. They will use these two fancy words on registry. And the butt. So make sure you know which is which. Your circulatory system physiology. Your blood pressure, which is the pressure that blood exerts against the walls of the arteries. Your systole, when the left ventricle of the heart contracts and it pumps blood from the ventricle into the aorta. And your diastole, when the muscle of the ventricle relaxes, the ventricle fills with blood. I want to know what a book normal blood pressure is. 120 over 80. I mean, 120 over 60, we ain't gonna do nothing about it. We're gonna look at it and be like, so. Working, that's the blood pressure on the top. That is rest. That hey, it works. So I mean, I have patients. Is everything over 140 is a book? Okay, per book, yes, 140. I didn't know the book changed. Oh, okay. Because I thought it was like one. I thought it was like 160, 170. What? Well, you also got to be two. Anxiety. Oh, I'm not talking about. You talking about her? The other dude. Okay. We can talk about it on break. We'll be taking a break here in just a minute. Blood pressure readings. Your systolic blood pressure is a high point of wave. And this diastolic blood pressure is your low point of wave. All right. You're anatomically adjusted and controlled. Your perfusion. So like I said earlier, your perfusion is your circulation of blood in organs and tissues in an adequate amount to meet the needs of the cell. Your hypoperfusion is your inadequate blood supply to the organs, tissues, and cell. So there's the hypo. Hypo means low. Hyper means high. That is probably a vocab that y'all want to keep in touch with. Inadequate circulation of the adult. The system can adjust to small blood loss. Your body is made to adjust, to adapt. Your vessels constrict, the heart pumps more rapidly with a large loss, your adjustment fails, and the patient goes into shock. talk about which different kinds of shock. Mean arterial pressure can help detect shock. Your functions of your blood. Fighting infection, transporting oxygen, transporting carbon dioxide, you're controlling your pH, transporting waste and nutrients, and clotting or coagulation. Your blood does a lot for you. Okay, so the nervous system controls the cardiovascular system. A lot of things in the body come back to your body revolves around the heart. That's how the body takes care of itself. The sympathetic nervous system is responsible for fight or flight. You're on run. Sends commands to your adrenal glands, your epinephrine, or your adrenaline, or your norepinephrine, or your noradrenaline, are secreted to stimulate heart and blood vessels. Blood vessels have an alpha adrenic receptor, and the heart and lungs have the beta adrenic receptors. The baroreceptors sense pressure in the blood vessels. The sympathetic or the parasympathetic nervous system balance each other. Okay, we'll take a break. The nervous system. All right. Nervous system. The nervous system is perhaps the most complex organ in the body. Divided into two main portions, you have your central nervous system, or CNS, and your peripheral nervous system. Your brain is controlling organ of the body. The subdivisions, the cerebrum, the cerebellum, and the brainstem. Your cerebrum is the big part. Your brainstem goes down and connects to the spinal column. And then your cerebellum. Cerebrum spinal fluid cushions and protects the brain and the spinal cord. Your brain is free floating in your head. So if you get a wreck, the car's going 40 miles an hour. You are also going 40 miles an hour. So if the car should have stop, you go forward, brain goes forward, slaps straight into your skull. I can get a TBI, concussion, stuff like that. Circulation in your head. Oxygenated blood is supplied via carotid arteries. Deoxygenated blood is drained by the internal and external jugular veins. So your spinal cord is an extension of the brainstem, transmits messages between the brain and the body. No, it does not send text messages. Divided into two main portions, your somatic nervous system and your autonomic nervous system. Your somatic nervous system transmits signals from the brain to your voluntary muscles, your arms, legs, shoulders, whatever. The autonomic nervous system, is your involuntary actions. You don't tell your body to breathe. You don't tell your body to digest the donut you just ate. You don't tell the blood, make sure you go from my heart to my leg this time, because my leg's asleep. Two types of nerves: the peripheral nervous system. Your sensory nerves can carry information from the body to the central nervous system. Okay, that's hot, or that's too cold. Your motor nerves carry information from the central nervous system to the muscles. That's hot, and I pull my hand away. That's how they work, side by side. Your skin, which is an organ. A lot of people don't think it is. I promise it is. Two layers. superficial, and your dermis, which is deeper. Have a cut, it only cuts first side of your skin, very, very minimal bleeding, plus a scratch, or a superficial cut. So bend it on it, move on. Your subcutaneous tissue lies beneath the skin. That insulates and serves as an energy and reservoir. Alright. So your epidermis is right here. Your dermis is what contains the nerves, blood vessels, and everything else in it. Your subcutaneous is the fatty layer down here, right above the muscle. The skin is the largest single organ in the body. Three major functions. It protects the body from the environment, it regulates the body temperature, and it transmits information from environment to brain. It's -2 degrees outside. Probably should put a coat on. Your digestive system. Your gastrointestinal system. So here are all three. The abdomen is the second major body cavity. It contains major organs of digestion and excretion, organized into four quadrants. Go from lower part of your sternum straight down to your pelvis and straight across. Organized into four quadrants. Right upper, lower. Sternum, straight down, and then straight across with your navel or your belly button. So, standing with it, my liver, gallbladder is all on this side, in the upper part, right? My stomach, diaphragm is on this side, is on the left side. My spleen is on the left side. So if there's black and blue bruising on the left side, on the upper side, maybe you can think maybe the spleen may have gotten injured. Your small intestine covers all four quadrants. Your large intestine covers all four quadrants. And it goes all the way around. Your appendix is lower right quadrant. So if someone has abdominal pain and they're pointing in this general region, hey, do you still have your appendix? Might be an idea to ask. Appendix is a pain in the butt. Come with that. Like I said, any lower pain, like I said, it does refer to the opposite side.
Which one does it?
Which one what? Your spleen is a very heavy organ that if it gets lacerated can bleed very quickly. But Christy, when your spleen bleeds, you can see it through the skin, can't you? Yeah, that's what I thought. Yeah, that's what I thought. Okay. System starts with your mouth. It does not skip and start only in the esophagus. It starts in the mouth. Lips, cheeks, gums, teeth, and tongue. The salivary glands, your esophagus, stomach, and pancreas. The liver, which has bile ducts, small intestine, large intestine, appendix, and rectum. Can you live without one of these? Can you live without one of these? Okay. Enzymes are added to food by salivary glands, stomach, liver, pancreas, and small intestine. Food is converted into basic sugars, fatty acids, and amino acids. Further processed by the liver, circulated via blood throughout the body. So, say you're a heavy drinker, is an alcoholic, has cirrhosis of the liver. What have you eaten today? Oh, I ate a burger covered in grease. And I slapped a bunch of bacon on it, and had pizza before that, and ate a bunch of fatty foods that your liver can't process anymore, or is having extreme struggles to process. All right, your lymphatic system is your spleen, your lymph nodes, lymph vessels, your thymus gland, and other components. Supports the circulatory system and the immune system. Lymph is a thin, straw-colored fluid that carries oxygen and nutrients to cells and waste products away. It helps to get rid of the body of toxins and other harmful materials.
Close the straw.
Close the straw. I have no idea. I wish I would have known. They got white, clear, I don't know. The straw. Endocrine system. Complex message and control system. Integrates many body functions. Hormones are released directly into the bloodstream, epinephrine, and insulin. The brain controls the release of hormones. Excesses or defiances in hormones can cause disease. I cannot speak today. All right, urinary system. Controls the discharge of certain waste materials filtered from the blood by the kidneys. So it controls fluid balance in the body, filters and eliminates waste, and controls pH balance. This is all about balance. Trying to keep homeostasis, which is balance. Trying to keep your pH balanced, trying to keep your fluids balanced. The body wants to stay in balance. Urinary system contains your kidneys, your ureter, and your urinary bladder. Okay, the male consists of the testicles, epididymis, vascular. English is hard, y'all. Prostate gland, seminal vesicles, and the penis. Female system consists of the ovaries, fallopian tubes, uterus, cervix, and vagina. Life support chain. All cells in the body require oxygen, nutrients, and removal of waste. The circulatory system is the carrier of these supplies and waste. As interference occurs, cells become damaged and die. Cells use oxygen to turn nutrients into chemical energy through metabolism. And aerobic metabolism uses oxygen. Cells switch to an anaerobic metabolism when oxygen is limited. These are registry favorite thing to say. Aerobic and anaerobic metabolism. It will ask you either which is which, or if I have an aerobic metabolism, this happens. Or if this happens, is it aerobic, anaerobic? Yeah, so anaerobic is without when option is limited. So I'm trying to think of a good way to explain it. You got one?
Think about when you're working out. Working out, everything's going good. When your body starts to hurt, that's when your body has went from oxygen to so that's when you move from aerobic to anaerobic. So I know it's weird. That's the thing about the like acid buildup and stuff. That's an anaerobic process. Whereas aerobic is running.
Working out and you're not breathing hard, like inhaling a lot.
No, it's how your body processes. Because think has a lower lung capacity. They're gonna breathe as hard as their body can ever make aerobic. Because they've already got less oxygen in their blood.
Because they don't have enough.
The movement of oxygen, waste, and nutrients occurs by diffusion. pH is critical to diffusion. The MIT something like diffusion is. We talked about it earlier. Mm-hmm. From what to what? Goes from high to low. So you want everything to be balanced. So if you have so much on this side, like if I had 4 of you on one side and one was by himself or herself, like you don't think if I don't want to be by themselves, I don't like being by themselves. So I don't want to be with the group. You know what I mean? Or a couple of them could go over there to make it even. You want everything to be balanced. Diffusion is just from high to low concentration. So from a bunch to a little to even it out to make it balanced. Or like if you have you have a lot of oxygen on one side, or one cell is getting all the oxygen and the other cells don't have any oxygen, the oxygen is going to diffuse to both sides to make everything equal. So let both get oxygen. The body expends a large amount of energy to maintain a normal pH. The human body's normal pH is 7.35 to 7.45. That is your normal pH. Lower than that, you are acidic. Above that, you are basic. Not white girl basic. Pathophysiology, the study of functional changes that occur when body reacts to disease. Respiratory compromise is the inability of the body to move gas effectively, which is your hypoxia, and our hypercarbia. Can I break down hypercarbia? Can you tell me what you think it means? Mm-hmm. What do you think carbia means? Yeah. So you have your hypoxia, so your low oxygen, and your hypercarbia, which is your high carbon dioxide. Alright, factors that impair ventilation. Is ventilation an active or passive? Uh, ventilation isn't even exhalation. Inhalation. Are you active or passive? I'm gonna see if you're ventilation is inhalation, exhalation, which are passive, and active. You see somebody caught it. Factors that impair respiration, change in atmosphere, high altitudes, impaired movement of gas across cell membranes. So here versus Colorado. People from here who are used to Colorado struggle to breathe in Colorado because it is a higher altitude. In Wyoming, when I went a couple years ago, I struggled with containing my breathing for a while because Wyoming is a higher altitude. Effects of respiratory compromise on the body. Oxygen levels fall and carbon dioxide levels rise. Respiratory rate increases, your blood becomes more acidic, your brain sends commands to the body to breathe, cells move from aerobic to anaerobic metabolism. Stark is it occurs when organs and tissues do not receive enough oxygen, so your impaired oxygen delivery causes cellular hypoxia. Categories in several types depending on the cause. So you have Stark, big umbrella, and then you have little ones underneath that. And everything falls under just one big umbrella. So effective the level of oxygen to the tissues falls, cells engage in anaerobic metabolism, severe metabolic acidosis. The baroreceptors initiate the release of epinephrine and norepinephrine. The heart rate increases. The fluid moves into the capillary. So basically, the body is going into, oh no, what just happened? I gotta fix this. So it results in an inability to properly use oxygen and glucose at the cellular level. Cells create energy through anaerobic metabolism, which can result in metabolic acidosis. Brain cells cannot use alternate fuels. Brain cells use oxygen and glucose only. They cannot use anything, nothing else works. Your brain constantly needs glucose and oxygen. How does it shut down? Cellular energy injury may become irreversible. Your brain cells do not regenerate. Like a lot of jokes for young boys when their heads on stuff. Great, they've got 2 brain cells left. Or you lose another one. Retroperitoneal states. Liver, spleen, kidneys, stomach. So when it comes to your anatomy, your vocab is coming into play. This is something that people who like vocab, this is something that comes into play. Because this straight up is they were the tiger were able to put cage together. That's great. Knowing how to break down an answer or a word like hypertropia. Never seen it before. I know what it means. Being able to break things down to a simpler thing will get you a lot more answers. And we got any guesses? Kidney? Kidneys live in the retrocranial space behind the abdominal cavity. So, kidneys, right here. So it's, I think it's the only organ that's straight up in the back. It's the carpus lunis costal arch, anagram, the angle of Lewis, xiphoid process. What's the tip of the sternum called? Right down here. Got it? Yep. Person with a bilateral female fractures has fractured one of his or her femurs, fractured both of his or her femurs, one femur is fractured in 2 places, fractured the lateral aspect of the femur. What does bilateral mean?
One it breaks in one
Yep.
right?
Yep. The most prominent landmark on the anterior surface of the neck is the mastoid process, cricoid cartilage, thyroid cartilage, and cricoid membrane. Sorry. What's referred to as Adam's apple? Insulin is produced in the liver, pancreas, thyroid gland, or adrenal gland. Blank connects muscles to bone. Huh? Okay. 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 Tendons. Take something. Tendons attach bones to muscles. Ligaments attach bone to bone. Normal resting adult heart rate is 70, 60 to 100, 80 to 110, 110 to 120. Okay. Left atrium of the heart receives blank blood from the blank. Oxygenated blood from the lungs, deoxygenated from the body, oxygenated from the body, deoxygenated from the lungs. See? See? Everybody go with me? Answer's A. Left atrium receives, so the right atrium receives deoxygenated blood from the body. Okay? So the left atrium receives oxygenated blood from the lungs because the right ventricle goes to the lungs. The left atrium goes to the left ventricle, the ventricle goes to the body. Something that'll help you out study is write out the path flow of the heart, where the blood goes. Make you a little chart. You don't gotta draw everything out. Just words, just input and arrow. Something that helps you out. The largest part of the brain is the cerebrum, brainstem, cerebellum, foramen magnum. Okay. Okay. So you got you knocked off two of them. Say. You got A or C. So you got A and C. All right. Answer's A. Hey, got it 50-50. That's something. So the cerebrum is the big part of the brain. All the big squishiness. You got your brainstem, which connects, and then your cerebellum is the little bottom part. Which of the following statements about the red blood cells is false? They contain iron, they carry oxygen, they help fight infection, they give color to the blood. Yeah. Everybody else agree? Yeah. Huh? Yep.